Hello friends. Today we are going to discuss about the recommendations of the National Task Force on Mental Health and Well-being of Medical Students. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about the task force report, specifically on the recommendations. This task force report is available online. You can scan this QR code and download the report. Please go through this report and find what are the difficulties faced by our medical students in India. This task force comprised of 16 members, and these 16 members played a crucial role in drafting this whole comprehensive report. The main objective of this task force is to give an evidence based recommendation to the National Medical Commission to improve the mental health and well being of medical students. In this regard, the task force did a thorough review of literature, looked into various systematic review, meta-analysis about the mental health and well-being of medical students globally and also nationally. Not only that, they also did a online survey of various stakeholders, that is UG MBBS students, postgraduate medical students, teachers, and various administrators. Not only that, they did a focus group discussions in various medical colleges with various UG and PG students and also administrators. Finally, at the National Medical Commission, stakeholders meeting was held. After all these meetings, quantitative and qualitative analysis was done with the available data. And finally, the task force came up with this report. And in this report, they found a basic problem. Nowadays, the medical colleges have become the center of service provision. That means the medical college has to be the seat of learning. That means usually the healthcare system depends upon the how the medical students are trained. Unfortunately, the medical colleges have become the service provision center and the medical education has taken the back seat. This need to change. Otherwise, we are going to have a medical students who are not trained properly, and we will be finding those doctors in the community who are not been adequately trained to deal with the public health problems of our country. This task force had 14 different chapters. I'll be focusing mainly on the recommendation. The task force recommendation has been divided into three important components. One is universal. That means it is applicable for all the medical college students, teachers, paramedical, and allied healthcare workers. The second one is selective. That is, people with high risk group. The recommendation is given. Who are these high risk group? The student with single parent, broken family, disabled, student from a backward community, from rural area, economically disadvantaged, chronic medical illness, taking care of a severely physically disabled person at home. And those are the people can be considered as high risk population. And finally, the students with mental illness is considered. If you look at the strategy, the universal recommendation is required for everyone who is within the campus of medical college and who is working in that medical college. Second one is for the high risk population, as I mentioned. And finally, the tip of the pyramid, which requires an intensive support for those medical students who are suffering from mental illness or who have attempted suicide. Hence, as you see the recommendations, it has been divided into three. Universal recommendation for the medical colleges. Second one is to the medical students, to the family members of the medical students, and finally to the medical faculty. The second one is identification of the high risk group and dealing with them or referral. Finally, the persons with mental illness and attempted suicide students. In the universal recommendation, as soon as the UG student or PG students joins the medical college, there should be a comprehensive orientation program. And this orientation program not only for the students, but also to the family members. The family members need to know the medical education is not for everyone. The students need to undergo a rigorous training. In this regard, forcing their ward or their child to do a MBBS or post graduation is simply creating a ruckus in their life. So, we need to orient the family members. Medical education is not for everyone. The student should be interested and should be ready to go through a rigorous training program. Not only that, the family members and the students should be given awareness regarding mental illness, mental wellness, doing yoga, and also what are the resources available within the campus, outside the campus. Further, anti ragging measures should be implemented. Further, every medical faculty and also the senior residents and other people who are working in the medical college should be made aware of mental health and mental illness. Counseling services should be made available within the medical college. These services can be from the Department of Psychiatry, or else the medical colleges can hire a third party counseling services. These services should be available 24/7. Not only that, it can be online also. Further, mentor and mentor mentee program should be implemented seriously with true spirit. It's not just an MC saying you have to do it. Mentor mentee program has a lot of potential. We need to understand this and we need to implement this mentor mentee program. Further, there should be a staff or a student clinic. That means this is the clinic which is specifically meant for to the students and also for the staff. Here, the student should go and take treatment free of cost. Many private medical colleges do not give treatment free of cost or subsidized rate. They will charge the student. That should not happen. Charity begins at home. That means medical colleges should play an important role in this regard. We need to have a professional courtesy not only for our fellow colleagues but also to our students. Hence, this staff clinic or the student clinic should be started not only for mental health but also for physical health. With regard to work environment, many medical colleges do not have the duty doctor's room, and even if they have a duty doctor's room, it is a courtesy sake. It is not well furnished. There is no toilet. Even the beds are there, and many a time these students do not get time to go in and take rest. These duty doctor rooms, if it is there, they have to be shared by at least 10 to 15 students. That should not happen. We need to have a well furnished duty doctor's room. Security should be appropriate. Security personnel should be available, especially in the emergency and also in the various wards and near the ICU and operation theaters. The work environment has to be conducive. Then only the students will learn in free mind. Hostel mess is a biggest challenge. Many of the medical colleges, the students complained against their mess. The simple reason is the students come from various parts of the country and many a time outside the country also. The food provided will be usually from the local place, and the food cannot be catered for everyone. Only few medical colleges have multiple mess. If they are able to do that, it's excellent. Otherwise, do not force the student to have the mess compulsorily. This will have an additional burden to the student. Another very contentious issue is regulation of duty hours. The junior resident should not work more than 74 hours per week. Here, they should not work more than 24 hours in a stretch. And every week, there should be one day off. This is very essential for their mental health and physical health. We need to understand. It is imperative to recognize that postgraduate and interns are primarily they are serving their educational purpose. They are not filling the gap of the healthcare services. This every policymaker should understand, every politician should understand. They are not here the government servants. They are students. They are here for training, not for providing services. This has to be very clear. If we do not understand this, we are providing a subsidized or poor healthcare to the patients. Not only that, we are not training our medical students properly. That means our public healthcare is in danger. We need to focus on proper training. And this training in the medical college should take the prime seat, not the health services. Health services is secondary. This dimensional shift should occur. I'm not telling that healthcare services should not be given, but the primary should be education, secondary should be health services. Every medical college should have a transparent and responsive grievous redressal mechanism. Students should be able to raise their concern and they should be addressed properly. A e-complaint portal should be established by the National Medical Commission, and this should be promptly responded, and complaints should be taken seriously, and redressal mechanism has to be put in place. The students, especially female students who get married either during the UG or in the post-graduation, the campus should provide childcare services and accommodation for the families who are the students who are married. Unfortunately, many colleges do not have any family rooms. This will add additional burden to the students. Many of the postgraduates require family support. Further, many private medical colleges do fail their students deliberately for the purpose of collecting fees. This should stop. This can be stopped only when the universities clearly make a policy. There will be no fees for repetition of the semester. And if it is there, it should be very nominal. And further, in the medical college campus, access to suicidal means should be stopped. There should be a committee within the campus which will do thorough evaluation of the campus, and they will find those hotspots where death by suicide occurs should be closed and complete surveillance should be kept. Another important things which came into the focus of the task force was the concerns of the teachers. Many of the medical teachers do not get uniform pay scale. Many medical colleges pay peanut to their teachers. Imagine if the medical teachers are not paid properly, then they will do private practice. They do not focus on training. The students are left alone in the hospital. That should not happen. We need to pay the central government pay similar to AIMS New Delhi. So there should be a uniform pay scale for all medical teachers, to the house surgeons and junior residents. This is very essential. If you don't do that, that means it is a forced labor, according to me. That should not happen. So, similar to uniform pay scale which is there for engineers, similar has to come here. Further, there should be a uniform retirement policy across the medical colleges. Either it may be central government medical college or the state medical government or the private medical college. And also uniform pension scheme for all medical teachers. Private medical colleges do not give any pension to the teachers. Hence, many of these medical college teachers start doing private practice so that they can build a private practice. And in this process, they will forget their student. That should not happen. We need to make their future secured. National pension scheme should be implemented. Further, uniform policy for rotation of headship should occur. In many private medical colleges, And of course, even in the government medical colleges, some of the HODs who are known to politicians or policymakers, they become HODs and they start behaving like the gods. That should not happen. There should be a rotation of the headship. That means every 3 years on rotation, additional professors should be given the headship. If there is a turnover occurs, that is very essential for a new thinking to come in. To improve the services within the medical college, the number of senior residents should be increased phenomenally. Of course, it will cost. That means health services will cost. You cannot provide services at peanuts. If you are going to do that, you will get a very poor service, and then public health will be in danger. We need to increase the number of postgraduate seats and super specialty seats in the area of need, especially in North India. Many places, specialty is not available. We need to increase those seats. Further, this seat living bond and compulsory rural service bond should be abolished. Simple reason is, why only for medical students? There are many engineers who have studied in government college, IITs, IIMs. Why not lawyers, judges? Many government people, many students who have studied in government should also have this compulsory services. Why only for doctors? And if you are doing the compulsory, you need to pay them. You cannot ask them to do a service which is free of cost or at the meager amount. That's bonded labor. And if you are forcing the students to do this, already the medical education, it requires 10 to 15 years for a specialization. For super specialists, it will take 20 years. This is not fair. Hence, we need to abolish this seat leaving bond, and also compulsory rural services has to be abolished. Yes, there are hiccups that needs to be sat and discussed. And further, if you go through the report, you will find that there are some suggestions have been given. Many a time, many students take PG seats and later they realize this specialty does not fits for them. Hence, there should be a trial observership. That means if the PG seat, they should be allowed to quit maybe after 3 months or within 3 months, so that they know what they are entering into it. Hence, this trial residency before joining or observership should be given so that the student knows what they are entering into it. Further, we need to use technology for training medical students. Further, we need to start various optional courses. Many medical students who are brilliant, they need to get an opportunity to learn law, maybe finance, maybe humanities, maybe various, maybe AI, maybe engineering, biomedical engineering. So they can learn something else apart from the medical education. This is only for those brilliant students and it should be optional. Further, to provide this optional course, the medical colleges can call invited guest faculties, maybe from IIT, IIM, or maybe any other engineering colleges, so that there is a seamless interaction between the medical college and various other institutions. Further, we need to start clinical linguistic language proficiency policy. That means many students from various parts of the country will go to a medical college. Imagine a student comes from all the way from various parts of the country to Bangalore. Here, most of the time, the patients will speak Kannada or maybe Tamil. That means the students who are not able to speak either Kannada or South Indian language will not be trained adequately. Hence, we need to start something called as clinical linguistic language policy. There, they can learn the local language which can be useful for clinical purpose only. so that the student learns the local language and get trained efficiently in the specialty. We need to address this ghost faculty. Ghost faculty are those who take 10,000 or 20,000 and they sell their certificate to the medical college and they go for practice. That should not happen. Hence, my dear friend, if you are a ghost faculty, please don't do that. Because of you, there are many students who are suffering. These students, for their life, they have not been trained adequately. That should not happen. We need to improve the sports and physical fitness within the campus. Further, career counseling and campus recruitment should start in the medical college. We need to establish health universities. In Maharashtra, Karnataka, there are health universities. We should not allow these medical colleges to be left alone to the universities, because universities have their UGC regulation and medical colleges has NMC regulation. And many a time universities may not understand what NMC says, or the medical colleges may not understand what UGC says. We need to announce the results with roll numbers only, not with the names. Many a time, having their name in the announcement board, it will trigger shame and death by suicide. Further, many of our medical teachers have not undergone training in how to teach. As soon as they finish their MD or MS, they become teachers. And they do not how to teach. That's really worrying. For example, when we teach for primary school or high school, those teachers undergo rigorous training, whereas medical teachers do not undergo any training with regard to how to teach. Either it can be pedagogy, andragogy, adult learning, they do not know. That means our medical teachers are very poor teachers. Further, we need to have a mental health and well-being committee within the campus, which will make sure these recommendations are implemented in true spirits. Further, library facilities should become e-library, online library, and these libraries should be made available in the hostel also. Many students study 24/7. So, the library facilities may not be available. After doing heavy work, going to the library will be very difficult. Availability of e-library within the room, especially in the hostel, will be a very boon for our students. Further, we need to start something called a Center for iCare. This is a center for innovation, collaboration. Further, we need to have entrepreneurial skills to our doctors and device development. And further, we need to develop research within the medical college. These are incubation, innovation, leadership, entrepreneur development centers. These centers in the medical college will collaborate with with various engineering colleges, maybe startups, various pharmaceutical industries, and also device development industries. Then the students can get exposed to the market. They can start thinking about doing research, developing device within the country. Unfortunately, 99% of the devices which we use in our country are imported from the Western country. But this can be changed if we are able to bring innovation in the medical college, and we need to change the way we think. Hence, my dear friend, we need to start this incubation center, innovation center within the medical college. Further, the medical colleges should liaison with IMA, NMO, even the local professional organization, so that they can provide training to the medical students and also PG. Further, we can provide yoga so that prevention and promotion of mental health can occur within the campus. Further, these recommendations also tell specific suggestions for medical students, such as effective time management, asking for help, social support, self-awareness, doing regular exercise, mindfulness, healthy habit, Seeking help from the mental health professionals should be done. Cultural activities should occur within the campus. It can be considered as Samajika Sanskriti Campus Council, where various competitions can be held periodically. It can be singing, dancing, rangoli, mime, videos, skit can be done so that the student enjoy the medical education. It should not become a burden. Now moving to the second important, high risk group. Here for the high risk group, peer support system plays a very crucial role. Hence, we need to start a gatekeeper program for suicide prevention, depression, so that the volunteers within the medical college, medical students get trained in mental health, suicide prevention, so that they watch their fellow colleagues if they are going into depression, if they are highly suicidal, they can do a referral, accompany them, and save lives. If you look at various studies, substance use is becoming a menace in the medical college. 30 to 40% of the students have used drugs. This should not become a huge epidemic. Of course, it's already an epidemic. We need to start de addiction services within the medical college and change the policy, something called as inclusive policy. If a student is found using drugs, do not punish them, involve them in the treatment. Then they can change their life. Punishing them, giving a punitive measures will cause dropout of the college, and then they become a menace to the society. That should not happen. Rehabilitation should occur within the campus. Students should be given opportunity, involve the family members in the treatment so that the rehabilitation occurs and he becomes a productive citizen in the society. The final one, student with mental illness or attempted suicide. As I mentioned, we need to have a supportive and inclusive environment. Just because somebody has mental illness, do not throw them out of the campus. The studies across the globe says 30 to 40% of our medical students are suffering from one or the other mental illness. It can be depression, it can be anxiety. So we need to provide treatment. We need to provide accommodation. We need to provide a support so that they can recover and complete their medical education. Of course, a severe mental illness can come in the way of practicing medicine. In such a scenario, fitness to practice protocol should be followed. That means there should be a committee. If a student is suffering from mental illness, especially severe mental illness, this committee will go through whether the student has taken treatment, what is the chances of he becoming danger to the other patients. We need to protect the patients also, and also our medical student. In this regard, fitness to practice should be considered. That means he can get a medical degree, but he should not get a license to practice. That means, imagine if a student has a severe mental illness, maybe schizophrenia or bipolar. He may not be fit to practice, but he can get a medical degree. He can become a pharmacist, or he may work in a factory, or he can work in a pharmaceutical industry. He can work in a clinical trial. He can work in various other places. He need not treat the patients. So that fitness to practice protocol should be followed. You should not have a blanket ban on students who are suffering from mental illness. Imagine 30 to 40% if they have mental illness. That means cross-sectionally we have 7 lakhs UG and PG medical students. 40% means invariably 2 to 3 lakhs. That means should we remove them? No. We need to recognize them, make aware of them, and start treatment so that they can be the champions for mental health and prevention of suicide. Finally, this report talks about mandatory reporting of suicidal attempts and death by suicide so that National Medical Commission knows what is the current mental health and wellness of our medical students across the country. This report has 7 annexures. These annexures starts with building resilience after tragedy. Imagine if a student death by suicide has occurred in the medical college. We need to use this opportunity, train our other students so that this tragedy can become a lesson, so that future tragedies can be avoided. Further, Appendix 2 talks about legal consideration if there is a suicidal attempt. As for Mental Health Care Act of 2017, and now Bharatiya Nyaya Samhita clearly talks about what should be done if there is an attempted suicide. If there is an attempted suicide, you should not make MLC for every case, based upon case by case basis. And if there is an abatement, then you should do MLC. If there is no abatement, if the person is going through a depression or a stress, please facilitate treatment, not punishment. Appendix 3 talks about myths and facts about mental illness and suicide. Every medical student and also medical faculty within the campus should know what are the myths and facts of mental illness. Appendix 4 talks about the orientation course which can be done for medical students, PGs, and faculty in the medical college. Appendix 5 provides resources where you can learn with regard to mental health and well-being of medical students. To conclude, my dear friends, this task force has submitted its recommendation to National Medical Commission, which was published on 16th August 2024. National Medical Commission has accepted all the recommendation unconditionally, and this report is available publicly. Now, the appropriate governments and universities should implement this report so that the mental health well-being of our medical students is upheld, and we can do these medical colleges be a seat of learning rather than providing health services only. That means every life matters. It is not only the patient, the doctors, the nurses, and various other healthcare professionals working in the medical college. Their life also matters. Thank you very much for giving your valuable time. Stay safe.